Welcome to CCS. Today, we will conduct a brief review of the Employee Benefits Program for the plan year 2023 on the benefits offered to all eligible employees. CCS offers Blue Cross Blue Shield of Arizona to provide 4 medical plan options to eligible employees. MetLife provides the life insurance, disability, dental, vision, and several worksite marketing products from which employees will choose the plans that best meet their needs. Triada will provide a GAP program. This plan provides a supplemental deductible reimbursement to cover claims and help with your out-of-pocket expenses if you should be hospitalized. CCS will continue to use the EASE system. This is the system where employees will log on and register to enroll or decline benefits or make changes during the course of the year if a qualifying event should occur. Note that the medical plans meet the Affordable Care Act's minimum essential benefits guidelines. The plan's anniversary date is January 1, and open enrollment periods will be conducted annually in early December. Note also that the medical, dental, and vision premiums, if any, are taken from your paycheck on a pre-tax basis. While saving tax dollars on these premium amounts, this plan requires a qualifying event during the plan year in order to make changes to the elections that you've made initially or during a subsequent open enrollment period. The medical, dental, and vision are also eligible under COBRA, which is a federal law that allows employees to continue insurance plans if they're terminated from employment and need to insure themselves during a transition between jobs for up to 18 months on a standard basis. First, the MetLife life insurance is provided to all employees and paid for by your employer. This benefit provides a $20,000 coverage amount payable to a designated beneficiary and a double indemnity or accidental death clause that doubles that benefit to $40,000 in the event of your accidental passing. MetLife also offers a voluntary life insurance program under which employees are guaranteed up to $150,000. Spousal insurance for life insurance is guaranteed up to $25,000, and all amounts are guaranteed for children if elected during your initial enrollment. The voluntary life can be taken in $10,000 increments by employees up to 5 times their annual salary, or $500,000, whichever is less. If amounts elected are over the guarantee issue amount when you're initially eligible, health questions would apply. You can take $5,000 increments on a spouse. As I mentioned, their amount of life insurance initially is guaranteed up to $25,000. If amounts above this amount are elected, health questions will apply and need to be approved by MetLife. The children benefit is increments between $1,000 and $10,000 on each child. Please note that after your initial enrollment in voluntary life, you can increase by $10,000 a year without health questions. If higher amounts are elected, health questions would apply in subsequent years where you elect increases in the voluntary life. Deductions for life insurance, when paid for by the employee on a voluntary basis, are post-tax from your pay. This ensures that the benefits payable will be tax-free. MetLife also offers 2 dental plans. A low plan and a high plan are offered, and employees will choose the plan that best meets their needs and the needs of their family. The low plan is different from the high plan in the sense that its annual maximum payable amount for benefits and services rendered is $1,500 per member per year, while the high plan is $2,000 per year. These plans also have a difference in the coverage for basic and major services. The high plan simply provides a benefit 10% higher than the low plan for each basic and major service types. The orthodontic benefit is a little higher in the high plan as well, providing $1,000 for dependent children up to age 26 for braces or orthodontic work that might be needed. The MetLife Vision Plan provides coverage in a network using VSP providers. This vision plan covers your annual diagnostic eye exam, during which you will receive a prescription and may wish to get corrective materials, either glasses or contacts. Under the vision care coverage, you'll simply pay a $25 copayment to receive your lenses covered at 100% for bifocal, trifocal, lenticular lenses. It'll also provide you with a $130 allowance to purchase frames. If you wish to have contacts in lieu of glasses, you may do so. If your contacts are elective, meaning not medically necessary, you'll pay a copayment of $39 for contacts and receive the same $130 allowance to purchase your contact lenses. If your contacts are medically necessary, it's a smaller copay at the standard $25 copay, and those contacts are covered at 100%, so not limited by the $130 allowance. Each of these services under the Vision Plan can be received and paid for by the Vision Plan provided by MetLife every 12 months. A couple of voluntary plans provided by MetLife called worksite marketing products include the disability plans, both short-term and long-term disability, two choices of accident plans in case your services or medical treatment are a result of an accident, and also a critical illness policy that provides 3 levels of critical illness coverage. Lastly, the worksite marketing products include a Triada GAP program. This program provides 2 GAP plans, one for PPO plan participants under the medical plans, and the second for high deductible health plan medical plan participants. Both are intended to help you with your deductible amount if you should be hospitalized while covered by this plan. The medical plan options provided by CCS Global are 3 traditional PPO plans with deductibles ranging from $1,500 to $6,000 in calendar year deductible amounts. The traditional PPO plans provide copayments, as you will see, for many services under which the copay is your only responsibility and the plan pays 100% of those services. The 4th plan is a high deductible health plan qualified by the IRS, and participants are allowed, based on this, to open a health savings account for tax-free savings and spending, which is the privilege of the participants in the high deductible health plan option. These plans all provide the same national PPO network. The same doctors and hospitals are in-network benefits for each of the 4 plans. None of the plans require a referral from a primary care to see a specialist. You can self-refer to specialists in all 4 of these plans. They all also cover the same conditions and medical treatments for any medically necessary services rendered by a provider. So what's the difference between these plans? Well, it's the cost sharing that you experience when you utilize the plans and have a claim that's eligible to be paid by the insurance company, and what your cost sharing would be as a result of those claims that you've incurred. If we take a look at the plans side by side, you'll first see that all the in-network benefits are reflected in the lower portion of this exhibit. The PPO plans provide 100% for the annual wellness exam or checkup for each member, covered at 100% as long as you're seeking out standard tests for a physical for somebody your gender and age. Copays apply to many services under these PPO plans. You'll notice that the copays do get higher as you go across to the lower cost plans, but primary care and specialist copays are offered under all 3 of these PPO plans. Copays also apply to emergency room, urgent care, and prescription drug benefits. As long as the prescription medication is listed in the formulary, you'll have the benefit of a simple copay, and the rest of that prescription is covered at 100%. Mail order is allowed under this plan, a 90-day supply for 2.5 times the standard copays that you see here. You'll want to take note of the deductible amounts. Each plan has a deductible amount that's accumulated through the course of a calendar year. The deductible applies in the event of a more serious claim, a hospitalization, a surgery, whether that's in or outpatient surgery, and even some of the higher dollar diagnostic tests like MRIs and PET or CT scans. The 4th plan is a high deductible health plan. This plan, qualified by the IRS, would allow the participants to have a health savings account. This is a bank account that provides tax-free deposits into it, tax-free spending as long as your spending is on the appropriate expenses, which we'll talk about in a couple of slides. But you'll notice this plan also has 100% preventative exam. No deductible or out-of-pocket spending should be incurred when you're seeking out a standard annual wellness checkup from your doctor. The plan also provides coverage for all the same conditions and treatments. They simply are discounted and apply to the deductible first. You'll notice that this plan has no co-payments for office visit, emergency room, urgent care, or even prescriptions. They're all covered. They just get discounted and they are applied to the deductible, which is your responsibility to pay until the deductible is reached. If you do reach the threshold of $3,250 of expenditures and met your annual deductible, the plan will pay 90%. You'll pay 10% of the remaining balance of that claim, unless you reach an out-of-pocket maximum of $4,000, which is including the deductible amount of the plan. Once you reach that out-of-pocket maximum, the plan covers 100% of your eligible charges and treatments incurred for the balance of that calendar year. It's important to note that this high deductible health plan also includes 100% coverage for maintenance medications. This plan provides no cost sharing for you, no deductible, no copayment, no out-of-pocket expense at all if you're taking an ongoing maintenance medication that's included in this list of 14 major categories of drug types and over 500 medications. The high deductible health plan is a fairly straightforward concept. It may seem different, but the IRS has removed the copays from that insurance program and is requiring that the deductible would be satisfied first before the insurance plan pays. This will be your insurance program for claims that exceed the out-of-pocket maximum, but can be covered up to multi-millions of dollars. It's unlimited, really, the maximum that can be paid. The second part of a high deductible health plan account is the bank account itself. CCS sponsors HSA Bank. This is the bank that pre-tax deductions can be forwarded from your paycheck into your own bank account. Relatives, anybody can put money in the account, including your employer. This money is accumulated in the account and, if unused at the end of the year, will simply roll over to subsequent years. So it's your savings for healthcare expenditures into the future, and even as long as into retirement when it's eligible to pay out-of-pocket expenses tax-free. The IRS does give us some limits. HSA deposits can't go over $3,800 and $3,850 if you have single coverage. Family coverage folks, which is employee and spouse, employee and children, full family, can deposit up to $7,750 in 2023. Note that there's a catch-up contribution for people that are over age 55 that join this type of plan and open a health savings account. HSA Bank will issue a convenient Visa debit card to each member so that you can access your funds once the bill has been processed by the insurance company. You'll simply write the card's credit card number down and pay the balance to that provider from your health savings tax-free account. What expenses are qualified as tax-free coming out of this account that you might pay for? Well, the medical out-of-pocket, deductible, and co-insurance limits will be able to be paid with the account tax-free. Also, dental and vision care out-of-pocket expenses that you might incur when seeking out those types of services. You noticed when I was describing those plans that there are some additional expenses you might incur. This account can be used tax-free for those expenditures, including the difference between the frames that you might get and the $130 allowance that you're afforded. Lastly, the money can be spent tax-free on your immediate family members, meaning those family members that are claimed on your annual tax filings. Even if they're not insured by this high deductible health plan through CCS, the account is available to them for you to spend tax-free for those family members. Note that the list of eligible expenses is quite large and can be seen at the irs.gov website. We can certainly give you some information on this as well, but you'll want to make sure that you fully understand what are eligible expenses, even some at the drugstore, before utilizing your HSA account inappropriately. How do you stay in network? You hear a lot about this, and it's probably one of the most important things with an insurance plan is to use their providers. These are freestanding physicians and hospitals that they've contracted for discounts. If you want to find medical providers, you'll simply go to azblue.com. Click on Resources, and it'll take you to a doctor find. Once you're there, you'll want to make sure that it knows you're a member who has a health plan through your employer, which is on the left-hand side, and you'll click on that indicator so it knows to look at group insurance plans. Once you've done that, you'll indicate in a drop-down box that you're in the statewide or national PPO network for all of these 4 plans, and you just enter a zip code, what type of provider you're looking for, whether it's their by name, what kind of facility, or what specialty type they have, and the system will pull up a list. You can download the list from there or simply scroll through and find a physician that meets your approval. MetLife also provides an online research tool to look up doctors or dentists in this case. You can also look at your vision providers, even though they're with VSP. You'll look at that network here at the MetLife site. Pretty straightforward, metlife.com/mybenefits. You want to register at this site by starting to enter your employer's name, CCS Global. The drop-down box should show you this company name after a few letters are typed in. You want to then select whether you're looking for a dentist or a vision care provider, and note that your dental plan is with PDP Plus as far as the network of dentists are concerned. The vision, as I mentioned, is with VSP. So you'll simply be looking through the system and finding physicians or practitioners that are closer to you and more convenient, or you simply like the bio that you read online about that physician or practitioner. Lastly, you should know that applications are available to you from Blue Cross and MetLife. Blue Cross has a standard app which pretty much mirrors the website called AZ Blue. It also includes an app called Blue Care Anywhere. This allows you to have office visits with physicians and get simple prescriptions for primary care from the convenience of your home or hotel room or wherever you might be. MetLife also has an application for your phone. If you register at My Benefits using the application, this system will show you your own plan, your own network, and be able to assist you in searching out dentists or even vision care providers that you might need to use after you're insured under the plan. Simply pick your zip code and it'll perform a search within a mile radius or a certain mile radius that you'll select in the search criteria. Both apps, or all three apps, are available on the Google Play or the App Store, so please download those on your phone, and that'll make things a lot more convenient for you, especially since the applications for Blue Cross include the ID card online. MetLife does not provide ID cards, by the way. Not needed in this case. You just simply find a network provider contracted with MetLife on the website, make an appointment, they'll verify your eligibility and shouldn't have any problems. If they can't verify your eligibility, that's a good sign that they're probably not in your network, and you'll want to check back and make sure that they're included in the website search that you did. To start your enrollment, you'll simply find the ease in email that was sent to your inbox. Log in, register if you haven't already, and select Start Enrollment to begin. Please review and update the profile information if it's incorrect. Just follow the prompts to review each option or each plan of coverage that you have available to you, similar to what you've seen here today. You want to select Continue to proceed through these next sections, and either enroll or waive each coverage option as you go through. At the end, it'll give you a chance to review the benefits you've elected, including the cost, and you'll be signing it electronically and finishing it up by clicking a button that just indicates that you're finished with that so the data can be pulled into the system. It's important to remember that this ease site works on all search engines. The best we found for using the search engine is Chrome or Foxfire. Those are the two that we found perform the best as you're enrolling into the system, but all web browsers should be able to be used as long as they're functioning. Next steps. Please find your email. The EASE email system sent out a blast email to all employees. That should be located in your inbox or in some cases in a junk or spam file. But find that email from EASE, click on the link, and you'll either be going through the enrollment activities and enrolling or declining coverage for all plans. Please review the profile information for your dependents and even for the designated beneficiary that you've selected into the system in case the life insurance benefit needs to be processed. If you have any questions at all about open enrollment, the benefits that are offered to you, or anything that you think is important, just call us. The Reese Group are your benefit advisors. Both Steve and Joanna are ready to help. Even outside of open enrollment, if you have questions about how the benefits work, just want to help understanding and explanation you get from the insurance company, or worse yet, have a problem that you see and need our help assisting, please contact us at any time. We're here to help and help you have a better experience with the employee benefits plan offered to you by your employer, CCS Global. Thank you for your time today. We appreciate it, and we look forward to speaking with you.